Doctors, what's it like when you go in for a doctor's appointment? Do you and your doctor discuss what's wrong with you, like it's a group project? Do you not go at all because you're your own doctor? It is a bit dependent on the field of medicine involved. For example, I don't know much about neurological issues, so if I went to see a neurologist, I certainly wouldn't be chipping in. For more generic conditions, I have previously offered my thoughts to my doctor about what it could be. Ultimately, I still go to the doctor, as they can prescribe drugs/order tests for me that would be difficult/questionable for me to do myself. Doctor here, family medicine. I self-diagnose most things, but for my 1-year-old daughter, I decided a while ago that I don't want to do that for her. So her pediatrician doesn't know I'm a doctor. I never told her. I want her to treat me like any other parent and explain everything to me like I'm 5 years old. I'm afraid of being too nonchalant with my daughter's health that I'll miss something, or the doctor assuming I know more than I really do. It's actually a strategy I've adopted since on myself. If I go to a doctor, say a gynecologist, for a routine checkup, I sometimes just don't say what I do, so I can legitimately ask dumb questions about things that I should really know, or so that the other doctor won't leave out important info that they assume I know for fear of insulting me. On the other hand, my regular doctors do know, such as the gynecologist who saw me through my pregnancies, and that enables more complex and nuanced discussions about health decisions, as in debating questions and giving me options that he wouldn't necessarily do with it, patients, because he can be sure I understand the medical pros and cons well once I'm given a basic explanation. Story 3. Doctor here. I'm not good at going to the doctor. I don't go often, but when I do, I usually just TFU, especially if it's a field of medicine I have no idea about, like say derm. That being said, the doctor usually knows I'm a physician as well, and so the language terms to be more technical. I also find that we practice less defensively with each other, since we can be more open. We could do ABC tests, but honestly what you probably have is X, so take this, and if it doesn't get better, then we can do ABC. Story 4. I'm an ER doctor, and sometimes I have other doctors as patients. For the most part, they're pretty good patients, because they can give a good description of their symptoms in a way that's useful to me. They usually ask good questions and are well equipped to have an informed discussion about their diagnosis and treatment. Sometimes it's hard for me to dial back my patient talk, where I simplify medical terms for laypeople. Sometimes it's challenging if their area of expertise is totally unrelated to the issue at hand and they don't recognize their limited understanding. The worst patients are those who have just a little medical knowledge and think they know everything. Some version of, "My aunt is a nurse, and she said I need a whole-body MRI for this runny nose." As far as self-diagnosing, I usually deal with my own minor medical issues. If I notice signs of something more serious, I would go to someone else. Story 5. It depends on what I'm going in for. As a background, I'm an oncologist, so I've trained in internal medicine before. For most internal medicine type stuff, I don't bother going in unless I need something that I can't easily get for myself, e.g. labs or images. For specialty stuff I wasn't trained in, I go in and try to give them the best history I can, but let them do their own thing. Story 6. Doctor here. In general, we are not good about going to the doctor. For me, it's physicals about half as often as recommended, and that time I had strep a year and a half ago that didn't resolve with whatever antibiotics I had in my medicine cabinet. When we do go in, it is like a group project. We usually hash things out together, but ultimately, I am going to defer to someone with more expertise than me in that area who can make an objective decision. I try to act like any other patient. Medical people can very much sabotage their own care by taking shortcuts or perhaps declining to approach their own problems the way other patients do. It's a mistake. I have seen harm done that way. I don't come in for trivial things like self-limiting infections or things that are harmless because I know that they are. But I do go see my regular doctor for problems that really bother me or for routine exams like anyone else. It can be weirdly stressful to be the doctor or the patient in this kind of interaction. I've learned to not let it bother me when I am the doctor seeing other doctors. It can be harmful to the doctor as a patient if you let that kind of interaction get to you. I try not to generate stress for other doctors who see me and know what I am. That could be detrimental to me. Story 8. My mom's a GP, and she usually just self-diagnoses most of the time, but will sometimes get a second opinion. She doesn't really go to another doctor, just calls them to ask about stuff. Her contacts are filled with all kinds of doctors. It's like a secret underground community. For stuff like getting ultrasounds, etc., then yes, they do discuss stuff like it's a group project. Story 9. I was sat in a consultation between two doctors, with one needing an ultrasound. They knew each other through work already, so it was very friendly and casual between the both of them. The patient doctor trying to figure out what was going on the ultrasound screen, and the doctor was teaching him the bits he didn't know. Story 10. I was at a lecture a couple of years ago, performed by two doctors who'd undergone treatment for breast cancer and written a book about it together. I remember her talking about her diagnosis. She was a breast cancer surgeon herself. You couldn't make it up. She walked into the room, saw her own scans with the doctor, and her heart dropped. She barely heard a word he said because she couldn't stop the flood of information she was getting. Looking at the scan, she knew if she'd need surgery, chemo, radiotherapy, how long it would be, what her estimated survival was. I don't think they discussed it like a group project, but I suppose she couldn't stop herself from listening to her own internal monologue since it was her own field. I remember her saying she'd found it, in hindsight, an incredible learning opportunity regarding how to interact with patients, and that she thought about it a lot. Story 11. I don't get involved in the management. I let the doctor seeing me lead that, unless they missed something huge, and I would just double check. The main difference is, I can present the whole history and relevant info in about 30 seconds flat, and the doctor with that info can just give me the management plan in about the same time. Fastest consultations ever. Very methodical. Story 12. My dad is the head of my local emergency department, so I almost never went to the doctor other than to get shots or physicals for sports or for my health checkup before college. But the general rule of thumb for my household was if you're not actively dying, we aren't going to the doctor. He was just capable of doing most of it himself. One time I cut open my hand pretty deep when cooking, and he sewed it up in the kitchen in like 5 minutes. Looking back on it, those days were pretty crazy, but the stories he brought back from the ER are much crazier. Story 13. I hope you get some doctors in here to give personal answers. Paul Kalanithi did address this a bit in his book, When Breath Becomes Air. At first in his cancer treatment, he was very involved in the decision-making, and the way he described the conversation with his oncologist was more like a collaboration. Later, she reminded him that he didn't have to participate in the decision-making and that he could just let her be the doctor and focus on himself. He ended up taking her up on this offer. So even between the same patient and doctor, the relationship varied. Story 14. As a veterinarian, many of my worst clients are nurses and doctors. Lots of questionable home diagnoses and treatments. Yeah, people and animals are pretty close, but we're not the same, and medicines don't work 100% the same. I agree about having difficulty dialing back the patient talk, though. These are folks that can understand medical terms, and I don't want to be demeaning, but I've got my dumbed-down spiel about things, and it just flows out. To be fair, I recognize that I'm probably annoying to my doctor, too. Although when I went in for surgery last year, I had a great time chatting with the anesthesia nurses about protocols until they drugged me. Story 15. I had a client dog eat a wild mushroom in his own garden. I was just dropping the dog off for the evening. Owners due back in 2 hours. I let the human doctor, client, know, and she said to leave him, and she was sure it would be fine, and cursed forgetting to pull up those wild mushrooms. I took him to the vet anyway, kind of without her blessing since she said to leave him, but I knew she would be fine with it. They did the whole vomit injection thing, and she met me there to pay the bill and take him home. She thanked me profusely and told me how much she appreciated me making the call to take him in when I knew better, in spite of her suggestion not to. She also described something as a doggy cold, Said the vet said that, I think she meant kennel cough, last week. She's definitely one of those doctors who 100% realizes that she is a human doctor, not a veterinarian, and that she has huge gaps in her knowledge, and that's okay. Story 16. The pace and density of the conversations is different, I'm sure. I'm an emergency physician who has over time treated various physicians in my community, including internists, surgeons, radiation oncologists, some from my hospital, and some not. Keep in mind that each specialty is quite different from the others. The rad wonk, for example, thinks and speaks differently than the orthosurgeon, and I felt like my treatment of each of them was really quite similar to treating a professor of engineering. Academically minded people tend to ask lots of questions and research stuff while you're out of the room, as compared to populations that request a more paternalistic bent and just want you to tell them what to do so they can get on with their day. I'm careful to credit that the number of hours that went into my family physician's training are the same as mine, simply a different topic. She knows tons of stuff about management and screening for chronic disease that I don't, and I know how to intubate people, manage a bad LSD trip, or use a jar of bubbles to distinguish between kids that are scared and kids that are head injured,